Hello everyone, I'm going to present my week 4 case. My patient OT is a 46-year-old white female. She presented to the clinic with the chief complaint of numbness and tingling in bilateral pinky and ring fingers. She does not complain of any pain. The symptoms started about 2 weeks ago. The numbness is exacerbated by her movements, especially when she's sitting in front of her computer typing at her desk for work. She says that the numbness is temporarily relieved by rest. The patient, to palliate the numbness, she's tried to apply ice on a couple of occasions, ice packs, which does provide temporary relief, but doesn't completely alleviate the numbness. So OT's medical history includes tension headaches and benign neoplasm of the meninges, which is resolved. She's currently taking a multivitamin and ibuprofen, PRN pain, especially for headaches. She denies any allergies and she denies any medical history of diabetes, sciatica, or of neuropathies. She has no family history of diabetes, hypothyroidism, or of neuropathic pain. OT denies usage of any recreational drugs. She denies smoking, and she consumes alcohol rarely, on occasion about once every 3 months. She denies ataxia, unsteady gait, double vision, and muscle weakness. The physical assessment for this patient started with an inspection of the patient's hands. We inspected for any deformities, any lesions, any redness. We also checked her radial pulse and checked her capillary refill. And we also checked for range of motion, which was full, and hand strength, using assessing her hand grips, and both were equal. And we checked for sensation. The patient was able to discern sharp versus dull on her finger pads and in all portions of her hands, on both hands. So she didn't have any issues with touch or sensation. We also assessed for Tinel sign and Phelan sign, which are signs of carpal tunnel, and the patient was negative for carpal tunnel with these tests. We assessed her gait, and her gait was steady. She didn't have any swaying. So the differential diagnoses for this patient included diabetic neuropathy, carpal tunnel syndrome, and vitamin B12 deficiency. The plan for this patient is to order several labs: CBC, CMP, vitamin B12, fasting blood glucose, and hemoglobin A1C, just to rule out diabetes. The patient was also referred to neurology for an electromyography. She was scheduled for follow-up after all of her labs resulted and after her neurology consult was completed. Thank you.